Case 45. A 20-year-old woman returns from a day hike in a densely wooded area and develops a rash that evening. The next day she presents to her physician. The patient has never developed a rash like this before and has hiked in this wooded area several times. Physical examination reveals that the rash is mostly on the legs, arms, and hands, areas the patient says were not covered by clothing. She is afebrile. What is the most likely diagnosis? Phytodermatititis, secondary to poison ivy. This rash is characterized by vesicles of less than 5 millimeters in diameter. However, vesicles often coalesce in severe rashes. Which type of hypersensitivity reaction is occurring in this patient? Type 4 hypersensitivity reactions, which are delayed or cell-mediated, include contact hypersensitivity from poison ivy, transplant rejection, hypersensitivity pneumonitis, granulomatous hypersensitivity reactions, and the tuberculosis skin test. Type 4 reactions are also important in the control of mycobacterial and fungal infections. So let's talk about the 4 types of hypersensitivity reactions. First, type 1, what is the mechanism? IgE binding antigen, what is the pathogenesis? Massive histamine release, and one example is peanut allergy, which results in anaphylaxis. Type 2, the mechanism IgG binding cell surface protein. Pathogenesis, tissue damage by immune system. One example, or 2 examples, myasthenia gravis and Hashimoto's thyroiditis. Type 3, the mechanism is specific antigen-antibody ratio. Pathogenesis, precipitation of immune complexes in vessel walls which activates complement. An example is post-streptococcal glomerulonephritis. Type 4, the mechanism is T-cell mediated. Pathogenesis, local release of inflammatory cytokines, and an example, poison ivy rash or the tuberculin test. So what was this the patient's first exposure to poison ivy? A key feature of type 4 hypersensitivity is that the patient must be sensitized to the antigen before development of hypersensitivity on subsequent exposure. The tuberculin skin test relies on the principle of prior sensitization to assess for previous exposure to tuberculosis.